COVID-19 had so many effects on so many different people all around the world, but today I will be talking about only one of those effects, the effect it had on people's mental health. But first, what is mental illness? It's caused by many different factors, including changes in mood, behavior, or thoughts. And these changes, can be caused by genetics because it has been scientifically proven that they play a role in a person's susceptibility to a mental illness. But unfortunately, the stigma surrounding mental health can prevent people from admitting that they have a mental illness or even realizing that they have one. And COVID 19 put a lot more stress on everyone's state, which put a stress on their mental state. Now, as I said before, because of the high rates of unemployment, the economic problems, the fear of yourself or your loved ones contracting COVID 19, people were under a lot of extra stress. And that increased the amount of people who developed mental illnesses during this time. Another side of this is the overwhelmed businesses. The businesses were not prepared for the transition from in person to out of person, which could have caused months long waiting lines in places that have them, and businesses that were planning to expand were suddenly unable to do so due to safety restrictions. There was also an increase in medical professionals with a mental disorder, a number that was already high before the pandemic. Another thing that shows just how important or just how high this change in mental health rates was that it was a bipartisan priority. This caused the appearance of school-based mental health clinics, and while these were controversial, they were still created and they still helped. And Georgia even passed the Mental Health Parity Act, which in an article about it states that a group of lawmakers from both sides of the aisle declaring 2022 to be the year of mental health in a state that is now near the bottom in a ranking based on mental health care access. This drastic change shows that the rates of mental health or declined and the rate of mental illness went up. So it is clear that COVID-19 caused the amount of people to be affected by a mental illness to increase, despite the arguments and the stigma surrounding the topic.